Many patients come to Recovery Without Walls in a very severe condition, on the wrong drugs for many years, self-medicating with very powerful substances. Often they've been to several other programs and not recovered. And when they come here, we often have to substitute one medication for another, a medication that is less destructive to their system. But it often takes time to stabilize that transition and then to gradually wean a patient. And sometimes after a week or two, a patient will say, you know, I felt better for a few days, but now I'm struggling again. And should I leave? Should I go somewhere else? Are you giving me the right drugs or the wrong drugs? And we listen to the patient, but we also encourage them, if you can stick with this, if you could gain the benefit of the holistic type of program, the psychological support, the physical support. We often bring in physical therapy or massage therapy. We often get the person to eat breakfast and eat 3 meals a day for the first time in many months or years. If they can stick with it and we could stick together, then our success rate is very high.
It's not uncommon for people to say, I'm good, I don't want to go any deeper. It's not uncommon for people to make an impulsive decision, right? Impulsivity is very akin to addiction, and that doesn't change just because you get sober. So to say, I'm out of here, is not an uncommon thing. It's kind of a reactive type of thing. The intensity sometimes of treatment, the reality of sometimes the work it takes could be too overwhelming. And it's not uncommon for people to want to leave reality, not dissimilar to when they numbed or escaped or avoided with substances. So oftentimes they want a flight. It's important to know that that is a very common thing that happens in treatment. You can want to do it, you just don't do it. So a lot of what we work with is being able to identify what is going on with you in terms of what is so difficult to tolerate that you want to leave. And so we use it as a springboard to look at maybe that reaction is exactly the same as in the past when they wanted to leave reality. And so while we acknowledge that, we stay with them and just normalize that it's okay to take a break, it's okay to pause, it's just not okay to self-destruct. And so we really encourage people to stay physically, stay symbolically, trust that this too shall pass. It's an old overused recovery phrase, but if you can sustain this moment, it might look a little differently in the morning. There's an image that I think of when I think around addiction treatment and recovery, and it's sort of, allowing someone to sort of kick you in the butt, allowing someone to hold your hand, and allowing someone to hold a flashlight in front of you to show you the way. And I think we do a combination of all three things. There's a gentle push, we're with you, and we also shine a light in the road that we're both walking on. It's not up to us as providers to decide what someone wants and needs. So it's really important that patients really co-create this process with us. And the extent to which a patient invests and care about what they need helps me to be able to meet them where they are. When patients come in, they are often at a place of feeling defeated and having lost control. So one of the things that I think this practice does really well is instill a sense that they do have control, that they do have choice, that we are not going to ascribe what they need, that they are actually a part of all treatment decisions. They're a part of the assessment process, they're a part of the diagnosis process, and they're an integral part of the treatment process. They are here to really co-create the treatment plan, and they're as valuable as a team member as other staff people are. It's not a privilege to make decisions around your treatment. It's actually our clients' rights, and we support that to the end.
the best detox team that certainly I'm aware of, and try to inspire other clinical groups to also do science-based detoxes, patient-based detoxes, not detoxes based on a schedule or an ideologic belief that it should only take 2 days when it might take 8 days. An old tradition which is outmoded in the addiction field, well, if they suffer a little bit, maybe they'll learn their lesson. Well, we scoured the world's evidence and we didn't find any evidence to support that. In fact, in our own care for people who've been through severe withdrawals, that just creates another trauma in their life on top of other traumas.